My year as president has been quite extraordinary, like no other year in my entire life. It is full of multiple opportunities for the Academy, but also some challenges. As you know, advocacy is our sole federal priority around physician payment, practice payment reform. And towards that end, I traveled to Capitol Hill 6 times. I traveled to Washington, to California, and then other cities, believe it or not, New York, Philadelphia, to really advocate for that issue. One of the things I found is the importance of building those relationships with our representatives. And that was one of my main goals this year. And I have been able to do that, to have one-on-one conversations with them, sometimes in their offices, sometimes in social situations, at skin cancer screening, the one we do on Capitol Hill, so that they completely understand the issues that we face, that they understand this is not physician salary reimbursement, but rather reimbursement to keep our offices open, to pay our overhead, to pay our employees. So I think that I've been effective in building those relationships, and we've made some strides forward. There was a modest increase, 2.5% for 2026. It's not enough, and we've not stopped. Let me tell you another thing that I did this year. I impaneled a task force, the ad hoc task force, on physician payment reform to look at ways outside of the box, beyond going to Capitol Hill, that we could approach this issue. And they, in a very systematic way, they have done surveys, they've looked at options. For example, would litigation be useful? They looked at that. Would it be useful to partner with other organizations? Probably. Would it be useful to have other organizations lead this fight? Probably. So would it be useful to have patients advocate for us? So we've really moved forward in terms of how to tackle this problem. And I'm happy to say at our upcoming board meeting this coming Tuesday, Monday, the board will hear that presentation and begin to decide how to move forward.